Assalamualaikum warahmatullahi wabarakatuh. We are from Group 12 would like to present about hand, foot and mouth disease or known as Hfmd in Malaysia for our BIO320 video presentation. Before I start the presentation further, allow me to introduce my group member which is Hidayah, FITRAH, SHAHIRA and HUSNA. So, what is HMFD? Hand, foot, mouth disease or HFMD is a common childhood illness caused by a virus. When someone comes into contact with the internal fluids of an infected person, it easily transmits. Hand, foot and mouth disease is a mild contagious viral infection common in young children. It characterized by sores in the mouth and a rash on the hand and a feet. Besides that, this HFMD is commonly caused by a Coxsackie virus. There's still no specific treatment for hand, foot and mouth disease, but by frequently hand washing and avoiding close contact with people who are infected with hand, foot and mouth disease, it may help reduce child risk of infection. In Malaysia, first documented outbreak of HFMD was reported in 1 April 1997. To prevent the infection, the parent and caregiver who are the key players in taking precautionary steps to prevent the spreading of the disease. They are important to be knowledge and awareness so appropriate preventive intervention can be tailored to curb the future occurrence of the disease. Next, we will see about the symptoms of HFMD. HFMD disease may cause all of the following signs and symptoms or just some of them. They included fever, sore throat, feeling unwell and red rash without itching but sometimes with blistering on the palm, soles and sometimes the buttocks. And painful red blister-like region on the tongue, gum and inside of the cheek. Then vomiting and lost appetite.
Factors. The most common cause of hand, foot and mouth disease is infection with the Coxsackie virus A16. The Coxsackie virus belongs to a group of viruses called non-polio enterovirus. Other types of enterovirus sometimes cause hand, foot and mouth disease. Oral injection is the main source of Coxsackie infection and hand, foot and mouth disease. The illness spreads by person-to-person contact with an infected person, nasal secretion or throat discharge, saliva, fluid from blister, stool, respiratory droplets spread into the air after cough or sneeze, common in childcare setting. Risk factor. Hand, foot and mouth disease primarily affect children younger than age 10, often those under 5 years. Children in childcare center are especially susceptible to outbreaks of hand, foot and mouth disease because the infection spreads by person-to-person contact and young children are the most susceptible. Children usually develop immunity to hand, foot and mouth disease as they get older by building antibodies after exposure to the virus that causes the disease. However, it's possible for adolescents and adults to get the disease.
Next, the complication for HFMD. HFMD can be more worse when it related with enterovirus 71. It tends to be more severe and more likely to have neurological or cardiac complication. Next, aseptic meningitis can occur with HFMD in rare cases. The condition is usually mild and clear without treatment. And for encephalitis, the inflammation of the brain or flaccid paralysis in rare circumstances. Next, the prevention. There are a few ways to prevent HFMD. First, a proper cleaning. Practice a proper cleaning of shared utensils and disinfecting contaminated surfaces. Next, hand washing. We need to always wash hand to prevent spread of HFMD. And we also need to avoid direct contact with infected individuals. We We need to teach kids how to maintain their own cleanliness and inform them the benefit of avoiding putting their hands or any other objects in their mouth. And for the people with the illness, they should limit their contact with others while there are enduring active signs and symptoms, because HFMD is highly contagious. And for the last one, never share napkin or personal items like towel and brushes.
There is no specific treatment for HFMD. Signs and symptoms of this disease usually clear up in 7 to 10 days. A topical oral anesthetic may help relieve the pain of mouth sores. Over-the-counter pain medications other than aspirin, such as acetaminophen, Tylenol, or ibuprofen, Advil, Motrin, and others may help relieve general discomfort. Since HFMD is a virus, antibiotic will not help. For conclusion, there is no pharmacological intervention or vaccine available for HFMD. A formalin inactivated vaccine has completed clinical trial in several Asian countries, but cannot protect against other major emerging etiologies of HFMD. So, we have to practice proper cleaning, hand washing, and avoid direct contact to keep ourselves from getting infected with HFMD. These are the references that we obtained for these studies. That's all from us. Thank you.